Hi, I'm Akanksha Sharma. I'm a neurologist, neuro-oncologist, and palliative care specialist at Pacific Neuroscience Institute, and this is a PNI Minute. A lot of patients with brain tumors, regardless of the type of brain tumor, will go through surgery and then they'll end up needing some kind of radiation therapy often. Radiation therapy can range from a couple days to often 6 weeks. The concept, however, is similar. We're using X-ray beams or high-energy beams to kill tumor cells. We're breaking the DNA of the cells so that they stop growing. Radiation therapy to the brain can have a lot of benefit in slowing the growth of the tumor or killing tumor cells, but it can also have a lot of risks and side effects, which is what I'd like to talk about. Most commonly, as a neuro-oncologist, we support our patients during the radiation therapy. The radiation oncologist is doing the treatment, but we're usually seeing them closely, especially at PNI. We make it a goal to see our patients every week or every 2 weeks to see how they're doing through radiation and to help them with their symptoms and manage any side effects they're having. The 3 most common things we see is number 1, fatigue, number 2, swelling in the brain, which can happen from radiation, and number 3, skin changes or skin toxicity. So in terms of fatigue, patients will often experience a significant amount of fatigue as they're going through the weeks of radiation. The first couple of weeks may not seem as bad, but this is usually a cumulative effect, and by week 3 or 4 or longer, they're getting quite tired. This is a common and normal phenomena. It will get better in most cases after the end of radiation and through the weeks following, but it does take time to get better. So we like to prepare our patients to expect the fatigue, and the number 1 thing you can do to help prevent or treat the fatigue is actually exercise, which might seem counterintuitive, but what we've found in all our studies is that none of the medications that are out there are helpful, and the only thing that really helps alleviate it is more activity. I usually recommend that patients have some kind of daily activity regimen, whether it's a walk, whether it's doing yoga, Pilates, Tai Chi, any number of things. If you keep up with some kind of schedule or activity, you'll actually feel better in terms of the fatigue. And the second symptom that we see is swelling in the brain. This can present as headaches, nausea, vomiting. It can present as weakness. It can present as confusion. Sometimes patients can have seizures. This often occurs because the radiation is killing off the tumor cells, but in that process, it's causing a lot of inflammation. The most common way to treat this is to give patients steroids, and the steroids have their own side effects, but they are very beneficial in alleviating the symptoms. So often your oncologist or radiation oncologist will prescribe a small dose of steroids for a few days to help reduce that inflammation and to help you feel better. We do try to wean those steroids off as quickly as possible because steroids can have a lot of side effects. And then the third thing we see is skin changes. This can look as inflammation on the top of the skin, the redness. You'll have hair loss in the area of the radiation. Sometimes it can be more severe, like a light burn. It just varies depending on how sensitive your skin is, what kind of radiation you're getting. But usually this can be alleviated by applying Aquaphor or similar creams to the area, some rich oil-based creams that can help put a barrier towards the radiation and also just alleviate the redness and the toxicity that comes from the skin.